This morning I'm going to talk about really about process and how to go about considering whether or not you want to do outpatient total joints in your ambulatory surgery center. And if you do decide to, what's the process? A lot about how and what. So today's objectives, we're going to review current trends in outpatient total joint replacement, why this shift is occurring. We're going to look at the challenges and the opportunities and the advantages of providing arthroplasty surgery in the outpatient setting. We're going to help you understand the process, patient selection criteria, some examples there, and the implementation steps required to successfully perform outpatient hip and knee replacements. We're going to go over some of the pre-op, perioperative, and post-op protocols. I'm not going to go into a lot of great detail. I think you heard some of the other speakers speak to those in today's presentation because I'm going to really focus on process. And then we're going to review the clinical, the financial models that are coming forward, the bundled payments, particularly around total joints. So should we get into the outpatient joint business? What we hear from the surgeons as we travel across the country and work with these facilities is that they're telling us that certainly it provides for an enhanced patient experience. Increased patient satisfaction. A lot of patients are concerned about going into the hospital setting because of infections, some of the things that they hear. It's improved productivity and efficiency for the surgeons, lower cost as evidenced in some of the literature that we'll share towards the end of the presentation. A lot more predictability around their schedule. They're not getting interrupted like their inpatient schedule with other procedures coming in like trauma or those types of things that are disrupting the schedule. More surgeons feel like they have more control as they do in the outpatient setting. The convenience and the ease of practice. Some of the surgeons say I'm doing less rounding, meaning I'm not going into the hospital every day and rounding on my patients. But one of the surgeons told me a couple weeks ago, you know, Marcia, I actually round more in my outpatient setting because of the way the facility is laid out. I can see my patient in recovery 2 or 3 times as I'm seeing my patients coming into to the OR, and they feel like I'm seeing them more than when I saw them did their procedure in the hospital. So, but less rounding is speaking towards the inpatient side. It can provide a significant differentiation. We'll talk about some of the things that are very economical to add to your program or to consider for your program and can make a huge difference. So you're going to see a greater market share differentiation and patients traveling from greater distances to come to your center. So as you think about this, there's really 8 key categories that I want you to carefully consider, and there's a lot of detail obviously behind all of these, but you really want to look at your payer trends. You want to look at what's going on in your market. And one thing I want to reiterate is that it really cannot be cookie cutter. There are lots of tools, there are lots of things that we can provide to you or others can provide to you to help you jumpstart your program, but do not take a cookie cutter approach. It has to be your program, it has to fit your culture, and it has to fit your market needs. So carefully look at those payer trends, what's going on in the market, the CMS guidelines. Education is huge. There's a huge shift in patient perception, particularly in markets that have not introduced this yet. So a lot of education on the patient family, a lot of education needed on the referral sources, the primary care physicians, and the staff in particular. We had one center where the surgeons just could not understand why I can't take that joint replacement procedure and bring it over to my surgery center tomorrow. And I said, time out, Dr. Jones. Your staff is not ready. They've never done a procedure. You don't have the equipment, instrumentation, the competencies of the staff. So it's very important that all of these operational considerations are taken very seriously. Look at what the competition's doing. What's the market share? What are your marketing plans going to be? Is your operating room pretty efficient? Now, most ASCs do run very efficiently, but making sure there's that's where it needs to be. Looking at your capital investment of your equipment, what are you going to need to do to train and hire your staff? Patient identification and selection, I'll give you a couple of green light, red light examples that we see in the centers we work with. And really wrapping that program around a health and wellness perspective is important. These patients really aren't sick. They're coming in for a total joint. So they want to get back to their healthy lifestyles. Pain management, the anesthesia protocols that I mentioned earlier, and the transition of care, making sure that any of those ancillary services are on board. The worst thing can happen is you send them to home care or outpatient physical therapy, and they really don't. Maybe they've never cared for a joint patient. So making sure that those pieces are in place. And then efficiency of operations, bringing the surgeons together and gaining consensus on those order sets, on those pathways, to make sure things are standardized and there's as least amount of variation as possible. And then making sure the outcomes are in place, that you're tracking those outcomes so that you can report those to the public and that you can work with your payers to gain those contracts.